My Ricky Griffin medication administration video. ID. You can scan the room. I'll begin by looking over the patient record and medication administration record to ensure that I have the right patient. So we'll be doing Jaguar Jones, the date of birth, 8/25/1963, 8/25/1963. MR number, 417-6352, 417-6352. The medication we'll be given today is heparin. So I have in the order here, heparin 5,000 units subcutaneously every 12 hours. Heparin 5,000 units subcutaneously every 12 hours. So we'll be making sure we have the right patient, it's Jaguar Jones, the right medication, being heparin, the right dose, it's 5,000 units, the right route is subcutaneously, the right time will be every 12 hours. Patient has not had this medication in the last 12 hours. The right indication, heparin is a blood thinner, so we're giving this medication to help prevent or treat blood clots. And then the right documentation, I will document the whole procedure and any reactions the patient has to the medication after finishing the procedure. I'll assess allergies, so using the patient record and the medication administration record, we have allergy to penicillin, And then now I will perform hand hygiene. I will also make sure that while I am drawing my medication and looking over the medication record, that this is a no interruption zone, closing the door to the medication room, not taking any phone calls, only talking with other nurses when it is appropriate when drawing this medication. We'll start by getting our vial. So I have heparin, is 10,000 units per ml. The expiration date is 12/5/2025, so it is in date. Here's the vial. I'll compare the vial to our medication administration record. So we have heparin, and then I will be calculating the dose. So with this vial, we have 10,000 units per ml. And with our medication record number, or medication record, we need 5,000 units. So I will be drawing up 0.5 mLs. For our correct route, we'll be using a tuberculin, since it's subcutaneous, we'll use a tuberculin syringe. So this is 28 gauge, 1/2 inch needle. Using sterile techniques, I will remove the syringe. And in preparation for drawing up the needle, or drawing up the medication, I will fill air into my syringe up to the amount of medication that I need, so it'll be 0.5. I will clean my vial. Here's the cap. Inject the air. And then dry out my medication. And I will remove any air bubbles to ensure that I have the correct amount of medication. And I have 0.5 mLs. I will get another nurse to verify my calculations for the amount being 5,000 units. Since there are 10,000 units in the vial, then it'll be 5,000 units or half an ml. And I will have them also verify that I have the correct amount in the syringe. I'll then make a label for my syringe with the patient's name, the medication, and the amount of medication to be given. And I'll place my label on my syringe in an area out of the way of my numbers so that I can still see that I have my appropriate amount. And I will do another check. So I have heparin, so that is the right medication. The right patient is Jaguar Jones. The right dose is 5,000 units, which would be 0.5 mLs. The right route is subcutaneous. The right time is given every 12 hours. The patient has not had this medication in the last 12 hours. The right indication, it is a blood thinner, so we're giving it to help thin the blood. And documentation will be done afterwards. I'll then take my vial, my syringe, and my medication administration record to the patient's room. Upon entering the patient's room, I will perform hand hygiene. I will verify that it is the right patient. So I have Jaguar Jones, date of birth 8/25/1963, 8/25/1963, MR number 417-6352, 417-6352. I'll then assess for allergies. Mr. Jones, I see you have a ban and in your medication administration record an allergy to penicillin. Is there any other allergies you would like to let us know about? No? I'll then, for the third time, verify my 7 rights. So I have Jaguar Jones. The medication is heparin. The dose is 5,000 units. The route is subcutaneously. The time is every 12 hours. The indication is it's a blood thinner. So we're giving it to help thin out the blood. And then documentation will be performed afterwards. I will raise the patient's bed to an appropriate height and lower the side rails. I will then apply a clean pair of gloves. And apply goggles. And I will explain to the patient what we're doing. So, Mr. Jones, I'll be giving you a heparin shot today. So the heparin shot will be going into a portion of fat. So we typically like to use the stomach for that. We'll be doing a 2-inch area around your umbilicus. So I'll assess that area to ensure there's no bruising. And also, before giving the medication, I would assess the patient's blood pressure, heart rate, or any vital signs that may be indicated upon giving this medication. So I will find my site, and we will expose the site, but do so in a way to maintain patient privacy. I will then clean the site, starting in the center and going outwards. We'll carefully remove my cap. Then with a subcutaneous injection, I will pinch the skin, and if there's enough room, I would like 2 inches that I can pinch up. I will then inject at a 90-degree angle. With heparin, you give it slowly. Since it is a subcutaneous injection, I do not have to aspirate beforehand. Remove, and I apply gentle pressure and dispose of my needle into appropriate labeled sharps container. I will then, before leaving the room, I will assess the patient to ensure there is no allergic reaction, there's no oozing or bleeding from the injection site. I will then remove my gloves and remove my gloves and goggles. Return the patient's bed to an appropriate height, low as possible, raising the side rails that I lowered. Then I will perform hand hygiene. I will then go back to my computer to perform the documentation for the site that I gave the medication, what the medication was, and how much was given. I would then, if need be, with the medication, go back and reassess the patient with heparin, making sure there's no excessive bruising around the injection site. And once all documentation is complete, I am done.